Management of Bone Fractures in the Older Adult, Prevention, Management, and Healing by Lisa Bryans, Abigail Mello, and Sarah Olin. Many patients experience post-fracture immobility, weakness, depression, subsequent fractures, and decreased quality of life. Up to 37% of patients will die within the first year, and 50% being unable to live independently. The best way to decrease the risk of fracture is prevention by improving bone mass through medications, supplements, and balance and strength training. Patients and families can also decrease the risk of falls by monitoring extrinsic and intrinsic factors. Patients or family members can check an older patient's house for loose carpets or rugs, ensuring the flooring is even and there is no water leakage or the possibility for spills on the floor. The area should be well lit, and patients need to wear non-slip footwear. Removing clutter or cords from the floor can also help prevent falls. Patients should also have had a recent eye exam with the proper prescription eyewear. Some intrinsic factors can't be changed, but we can monitor patients for change in cognitive impairment, gait and balance disorders, should be monitored to assess for the need of an assistive device, problems with sensory or postural hypertension, or a history of falls. Patients should also have their medications reviewed to assess for the need to discontinue any medications. These factors can decrease a patient's ability to regulate movements and to compensate for slips or disturb balance during everyday activities. To assess for osteoporosis as you age, your physician should order a dual energy X-ray and check your T-score. According to your results, your physician will order medications, biophosphonates, or calcitonin if needed. Taking vitamin D, calcium, and protein may also be needed, but for optimal improvement, balance and strength training has shown to be the most effective fall prevention strategy in the general community living at an elderly population. If a fall or fracture does occur, your treatment plan needs to focus on these 5 factors for optimal healing and improved quality of life after a fracture: improving bone density, muscle strength, balance and mobility, and assessing and treating depression and pain. Medications prescribed will be according to your physician: biophosphonates or calcitonin, vitamin D, calcium, and protein. During the healing and rehabilitation process, it is important to strengthen training, as stated also. With physical rehabilitation, the majority of functioning recovery occurs within the first 6 months, because inactivity leads to increased disability. Physical rehabilitation improves strength, balance, and mobility. An unsteady balance leads to increased mortality, increased hospitalizations, and placement in nursing homes. An increase in disability from immobility can lead to depression. This can manifest as change in memory, sleep disturbances, an alteration in appetite, fatigue, pain, social withdrawal, or loss of interest in self-care. If a patient who is healing from a fracture is not able to do the things they enjoy or have autonomy, they are at increased risk for depression. Education for patients on social support, community resources can help through the recovery process. Social interaction during exercise sessions can also help patients bond with other people in the older population going through the similar problems. The treatment plan of pain after a fracture can affect the patient's healing process. 42% of patients experience persistent pain up to 4 months after fracture, and 25% experience moderate to severe pain lasting 12 months. Pain can have a negative influence on the quality of life, mood, physical activity, mobility, and life satisfaction. Adequately assessing and treating a patient's pain during healing and rehabilitation can improve patient outcomes after fracture. Unfortunately, the risk of a hip fracture only increases with age. It is crucial to first focus on prevention to improve bone mass, strength, and balance to decrease the risk of fracture after a fall. It is crucial nurses apply these interventions and monitor patients' progress to improve outcomes. Thank you. I hope you have enjoyed this presentation.